Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them capably. Today, we discuss RNA hepatitis viruses, which target the liver. Try these before we start. Which RNA hepatitis virus needs hepatitis B to replicate? Which one's linked to liver cancer? Which pair spreads through contaminated food or water? Let's launch. All hepatitis viruses target the liver, causing jaundice and liver dysfunction. These viruses often have long incubation periods. People may spread infection for weeks before symptoms appear. We covered hepatitis B, our only DNA hepatitis virus, in another episode. Check that out. Here, we focus on the RNA hepatitis viruses. Hepatitis A and E, which usually cause quick infections, spread through contaminated food or water. Hepatitis C and D, which often become persistent, spread mainly through blood, like HBV. HAV is a positive sense single-stranded RNA virus from the Picornaviridae family. Its RNA can be used right away to make proteins. It lacks an envelope, so it's stable in the environment, able to survive in food or water. HAV mostly affects travelers or people exposed during outbreaks. Infection is always acute. Early symptoms include fever, nausea, vomiting, and diarrhea. Jaundice appears a few days later, sometimes with dark urine and pale stools. Complications are rare but may include severe hepatitis. HAV doesn't cause cancer. Symptoms alone can't distinguish HAV from other viral or liver illnesses, so antibody testing is needed. Treatment is supportive, focusing on addressing symptoms. Prevention relies on an inactivated vaccine, especially important for high-risk groups, including travelers, kids in endemic areas, close contacts, men who have sex with men, food handlers, and patients with chronic liver disease. Next is HCV, a positive sense single-stranded RNA virus from the Flaviviridae family. Its envelope makes it vulnerable outside the body. HCV mutates often, which helps it escape antibodies and stay in infected cells. HCV spreads mainly through blood, such as in contaminated needles or transfusions. Sexual transmission is less common. High-risk groups include people who share contaminated needles, are on dialysis, or have multiple sexual partners. HCV often causes little to no early symptoms. Mild fatigue may occur, but chronic infection can silently damage the liver over years. Up to 1/3 of people with untreated HCV develop cirrhosis or liver scarring. Hepatocellular carcinoma, a form of liver cancer, may also occur. Both usually appear decades after infection. Diagnosis relies on antibody testing, followed by HCV RNA detection by PCR to confirm ongoing infection. Treatment with direct-acting antivirals like glecaprevir can be curative. There's currently no vaccine. Screening blood before transfusion, not sharing needles, and practicing safe sex prevent HCV. Next is HDV, a negative sense single-stranded RNA virus classified as a delta virus. It's a defective virus that cannot make its own envelope. HDV may only replicate in the presence of HBV's HBs antigen, which serves as its envelope. Negative sense RNA viruses convert their RNA into positive sense RNA before making proteins. HDV spreads the same way as HBV, mainly through blood and sexual contact. High-risk groups are people with chronic HBV. Infection can occur as co-infection, where HDV and HBV infect at the same time, or as superinfection, where HDV infects someone with existing HBV and causes more severe hepatitis. Complications include life-threatening hepatitis. HDV cancer risk comes indirectly from HBV infection. Diagnosis relies on antibody and PCR testing. Treatment targets the underlying HBV, sometimes using interferon. Prevention is via HBV vaccination, which also prevents HDV infection. Next is HEV, a naked, positive sense single-stranded RNA virus from the Hepaviridae family. The virus primarily affects people in low sanitation areas and pregnant women, especially in the third trimester. Infection is usually acute, with abrupt fever, jaundice, and loss of appetite. Pregnant patients may develop severe hepatitis. HEV doesn't cause cancer. Diagnosis relies on antibody testing. Treatment is supportive with fluids and rest. Access to clean water prevents HEV. A vaccine exists, but only in China. Let's review. Which RNA hepatitis virus needs hepatitis B to replicate? Answer: HDV. Which one's linked to liver cancer? Answer: HCV. Which pair spreads through contaminated food or water? Answer: HAV and HEV. No errors. Resplendent. Help us grow by pressing like, share, and subscribe. Scan the comparison table in the description. Thanks for watching.